Boost weight loss. According to studies, you will probably lose some weight when you fast, regardless of how you choose. But a more important advantage to be aware of is that fasting helps reduce belly fat. Losing excess weight in your midsection can improve your health since it lowers your risk of developing heart disease. Lower blood pressure. The beneficial impact fasting has on your blood pressure is well supported by science. You'll see a drop when you follow it for a long time. Your readings return to their initial values after you quit. Ease inflammation. Your body's inflammatory response is initiated by tiny proteins called inflammatory cytokines. After 3 weeks of fasting, the amount of these proteins decreases, according to studies on men and women who fasted during the Muslim holy month of Ramadan. Fasting improves symptoms and lung function, according to studies that looked at persons with asthma. Lower cholesterol. Despite the lack of conclusive evidence, a few small studies suggest that fasting, particularly alternate day or every other day fasting, can lower LDL cholesterol. That kind can accumulate in your arteries. HDL cholesterol doesn't appear to be impacted by fasting. Boost brain function. Up until now, research on animals has provided the majority of knowledge about fasting and brain function. Studies on fasting rats demonstrate that the brain's shape and the number of nerve cells within both improve. Researchers are investigating how this can slow diseases like Parkinson's and Alzheimer's, cancer risk. Studies on animals and cells suggest that fasting may inhibit the growth of tumors and improve the efficacy of chemotherapy in cancer patients. Human research into how fasting influences cancer risk is still in its infancy. Improve insulin resistance. Recent research on individuals with insulin resistance suggests that fasting may enhance insulin sensitivity. There is much more to learn. Better sleep. On how fasting might impact your sleep, the jury is still out. According to some research, it may reduce the quantity of rapid eye movement, REM, sleep, the stage of sleep during which you dream and your brain consolidate memories. According to other studies, fasting may increase the number of hormones that awaken you during the day. Longer life. Scientists claim that more human studies are required before we can definitively determine whether fasting lengthens life. However, studies to date indicate that it enhances health in ways that might lengthen your life, such as preventing cell damage. Stronger immune system. There isn't much human study yet, but fasting may enhance immunity. Studies on rodents and a small number of participants in a clinical trial demonstrate that fasting while receiving chemotherapy promotes the growth and protection of new white blood cells. Clearer skin. There are many claims that fasting helps eliminate acne and improve skin, however, there is little scientific evidence to support these claims. Better stroke outcomes. Studies on animals demonstrate that fasting speeds up healing after a stroke and prevents brain damage. Charm Huxley channel. If you are new to this channel, hit subscribe button and smash our notification bell button.